So let's get on with it. Let's go take a look at some of those big issues. And where better to start than the opening press conference.
I'm delighted to be chairing this opening press conference ahead of the inaugural session this evening at 7 o'clock, and it's my hope that each of the speakers today that we have will provide you a taste of the kind of issues that we're facing with regards to tobacco control. There's a lot to celebrate, of course. There's the World Health Organization Framework on Convention on Tobacco Control, the FCTC, and it turns 10 this year. It's a remarkable achievement with 168 signatories to its name. At the same time that the gains that have been made, we are constantly being challenged, and we hear little today on the emerging new tactics being employed by the tobacco industry to prevent, delay, and derail those anti-smoking efforts.
In 2013, the World Health Assembly agreed on a set of targets for NCDs, and I'm going to talk about two of those. One target is about the reduction, a 25% reduction in mortality from the 4 diseases that I have spoken about by 2025. And to help the world reach that target, there is also a target of reducing tobacco use by 30% using 2010 as the level.
The hosting of the World Tobacco Conference in Abu Dhabi is part of the commitment of the UAE government towards the control and elimination of tobacco. One of the examples of this commitment is the establishment of the UAE law in the year 2009. The law has really touched into different aspects of tobacco control, from the access, the environmental, the passive control of the passive smoking, and different aspects and successful strategies towards tobacco control.
You know, I grew up with a generation that used to see the wonderful silver tray packed with packets of cigarettes, neatly packed and literally being offered to special guests, as like you do with chocolate. That was the time, that was how normal it was. Of course, now we know the facts, and you know, we know that tobacco is expected to kill 1 billion souls this century. And this is ridiculous. If any of us, you know, opened the newspaper one day and we said there's a big killer that's going to attack 1 billion souls this century, I think armies would be amassed in 1 second. Recently, Philip Morris re-entered the Jordanian market in a big way. They've acquired 85% of all the local companies. And again, how come they honor us with their presence? You know, Jordan is a very small market. Again, it's because they've lost their money-making countries in Europe and the US, and they're coming in a big way in developing countries.
I do want to reaffirm that the United States is firmly committed to this fight against tobacco and to reducing the number of tobacco-related deaths. We have every day 3,200 of our youth who are trying a cigarette for the first time. We anticipate that 5.6 million of the children who are alive today will die prematurely as a result of tobacco-related disease. And we also see that the number of illnesses, including cancers, that are attributed to smoking increase. There's a tremendous burden that we were all facing from tobacco-related diseases. This is a global problem, one that demands a global solution and global partnerships, and that is why I am so happy to be here with all of you today.
So certainly a lot to get your teeth into there, and if those statistics are right, 1 billion people may lose their lives this century due to tobacco-related illnesses. Haven't we got our work cut out this week?